Hello, everyone, and welcome to the February 2022 PQA Quality Forum webinar. My name is Amanda Ryan. I am Director of Education here at PQA. Today's topic is the 2021 Trend Report in Pharmacy Quality, which describes the impact of COVID-19 on pharmacy and drug utilization. Before we get started with our topic today, I would like to walk you through a few housekeeping items. First, please submit your questions during the presentation as usual using the Q&A feature that you will find located at the bottom of your screen. However, we are going to try something a little bit different today to make the webinar more interactive and encourage engagement. We will pause a couple of times during the presentation to address your questions as they come in. So as soon as you think of those questions, please enter them using the Q&A feature. And then, as usual, we will also have a Q&A discussion time at the end of the webinar today. Also, the webinar recording and the slide deck will be available for PQA members within the week following the presentation, and that will be in the member resources library on the PQA website. And then the recording will also be publicly available on PQA's YouTube channel. Lastly, I would like to encourage all attendees to please complete the 1-minute survey that will launch at the end of the webinar today. PQA would like to thank Pharmacy Quality Solutions for being an educational sponsor of today's Quality Forum. Thank you to PQS for your support of PQA both today and throughout the year. And you can learn more about PQS at pharmacyquality.com. With that, it's my pleasure to introduce today's speakers. First, we have Brittany Boyd, who is the Senior Manager of Pharmacy Training and Support at PQS. She works directly with corporate pharmacy organizations and independent pharmacies to provide strategic initiatives on improving performance on medication-related quality measures. The initiatives Brittany has created over her 4 years at PQS are educationally driven, and they include webinars, resource documents, and other mixed media content. Brittany is a certified pharmacy technician with 12 years of diverse pharmacy experience and a master's degree in healthcare administration focused on leadership and organizational development. Also with us is Andrew Thorne, who is the Senior Manager of Data Analytics at PQS. He serves as the content matter expert for performance measures and leads the scholarship initiatives at PQS, in addition to leading the analytics team. Andy is a pharmacist with residency training in clinical pharmacy practice and health system pharmacy administration. Prior to joining PQS in 2021, Andy was the System Clinical Manager of Investigational Drug Services at UNC Health in Chapel Hill, North Carolina. Thank you, Andy and Brittany, for joining us today. And with that, I will turn the floor over to Brittany.
Good afternoon, Amanda. Thank you for having us on today. Thank you all for joining. I will take us through the overview of our presentation for today in relation to the Trend Report in Pharmacy Quality. And we're going to take this through the dive of all the chapters of the Trend Report. So first up on the agenda, we're going to take a review of the actual Trend Report itself and kind of the history of why PQS began the journey of reviewing the trends in pharmacy quality data. Chapter 1 today is going to be directly related to the COVID-19 pandemic and the different changes that we saw that occurred in the pharmacy throughout the course of the 2020 year. Chapter 2 I'll transition over to Andrew, who will take us through the utilization of hypothesized COVID-19 treatments. And then he will also wrap up into Chapter 3 to give you all a viewpoint into the utilization patterns impacted by COVID-19. And this is also going to be due to different medications and different classes of medications. And Andrew will take us through that. Next slide. And so as an introduction to the Trend Report, I wanted to give you all some background, the reason why the Trend Report was actually created by our CEO, Todd Sega. It was created to educate the marketplace and inform our healthcare payer partners and pharmacy providers and other life science organizations on what we are currently seeing in the pharmacy industry. We recognize that when we engage with patients in the pharmacy and being able to provide a high level quality of care, there are different things that we may be seeing on the pharmacy end, on the payer side, and the way that we're actually providing direct care to those consumers. So this 2021 report is a bit different than the ones that we have done in the past, since we are focusing on the public health emergency that is COVID-19. It was declared a public health emergency by the World Health Organization on March 11th in 2020. And there have been several national impacts that have national events that have impacted the way pharmacy utilization has changed throughout the course of 2020, and the different trickle-down effects that we have now seen even here in present day. And so we saw the Center for Medicare and Medicaid make adjustments to the fills they were authorizing for their patients, allowing for prior authorizations to go through in the pharmacy. We saw that some of our pharmacy groups actually were beginning to transition how they provided care, whether that be through curbside service or allowing actual delivery of medications to the home directly. And then the Coronavirus Aid, Relief, and Economic Securities Act, or the CARES Act, that was instilled on March 27th in 2020, allowed for unemployed civilians here in the country to provide some relief there financially. We saw, again, some impacts being made to healthcare and just being able to assist where it was needed throughout the country. And so there were certain weeks that did occur in 2020 that are directly related to this, and they actually are going to be our guide points throughout the presentation today, and really kind of our pinpoints for the performance data that you'll see us address here throughout the presentation. Next slide, please. And so we'll move on now into chapter 1 and understand how some of those public health events and just the different things that we saw throughout 2020 really made an impact to the pharmacy usage. So chapter 1 refers directly to all of the changes that we see in pharmacy utilization as a whole. We will see changes in prescription volume. We'll see an increase in day supply versus a lower day supply that we would not have typically seen in the pharmacy. We also will explore some ideas about how specialty medications were also impacted. But I want to call out some key items here that will kind of serve as the beginning and the end for how we'll review this presentation today. So when we refer to at baseline throughout the presentation, at baseline is actually directed to week 3 of 2020. The slide that you see on your screen here with this performance graph is really showing you how pharmacy utilization as a whole was a difference from 2020 versus 2019. Excuse me. And as you can see, at week 12 is actually the declaration of the COVID-19 being a public health emergency. We see week 17 where unemployment rates reached a record number. And then in week 27, we see the COVID-19 cases and reported deaths of COVID-19 hit another all-time high at week 27. And again, this is in 2020. And so the graph you see on your screen gives you really a high-level overview for you to clearly see how 2020 in the pink is very different from 2019 in the gray, where we would typically see pharmacy utilization in its peaks and its valleys throughout the year, month over month. And we also see kind of that large decrease and that dip down once we hit weeks 48 through 52. And that's typically because of the holiday season. Some of that may also have been mimicked in 2020. But as you can see, starting at about week 9 all the way through about week 13, we see a very large variation in comparison to the year prior. And so we're going to take a look at the details of all of these items and really understanding where there may have been an impact versus another. If we take a look at week 12, you see there's an 8.5% increase in overall pharmacy utilization. And again, that's the declaration of the public health emergency versus where we see in week 21, there is a 10.7 drop from baseline of pharmacy utilization. And we have some, I guess, hypotheses or ideas of how we believe this was impacted based on the data that you'll see next. Next slide, please. Okay. For the chronic medication prescription claims that we reviewed, you see here, again, in the pink for 2020 compared to that of 2019, we see that 18.9% increase at week 12. That was when stay-at-home orders were beginning to be put into place. And so we see lots of patients going into the pharmacy to say, hey, I want my prescriptions filled. We don't know what's going to happen next. I'm not sure what's going on, but I know that I need to have my medications on hand. And so pharmacies here were actually being extremely flexible at the time to encourage their patients to come in to actually get these fills completed. And again, that 18.9% increase you see is from the baseline of week 3 in 2020. We see a drop that occurs between week 9 and week 12. And a lot of that is more than likely due to what you'll see later, but extended day supplies, the fact that you had such a large increase there at week 12 already with patients going into the pharmacy directly. And then from weeks 21 through the end of the year, you kind of see how the trends continue to follow, where there's a peak and then we have a valley. We go to a peak and then we have a valley. And throughout that, what you can also really contribute to the way that pharmacies and patients are actually accessing their medications, that period of time there at week 12 actually made a long-standing impact, not just to pharmacy utilization, but also quality measure impact. And so for the medication-related quality measures that our chronic medications are directly attributed to, we'll speak to that in a moment, just about how what occurred in 2020, we are now seeing the results of that here in 2022. Next slide, please. So as we discussed, we talked about how chronic medications had a very high peak at week 12 in overall utilization. And so what you'll see here is actually the day supply differences that have occurred throughout the year. And so in the dark purple, you can see that 90 plus day supplies had a very high increase. You'll see in that lighter purple, the lavender color, the 28 to 89 day supplies that were put in. And in that gray, you will see those that are getting fills for less than 28 day supplies. And so throughout the year, we predict that there are a number of reasons as to why these variations have occurred. And so as you see, there's a 25.5% increase again at week 12, and that is in comparison to baseline of when the prescriptions jumped up and having that extended day supply. We believe a lot of the reason being is, again, as previously stated, folks were at home. We didn't know what was going to happen next. And so everyone was trying to have their medications and being able to have them on hand just so that they can continue to be taken care of. And so throughout the year, we continue to see that rise of the 90-day supplies. And that's also why we see some of the valleys. So for most patients, if they're going in and they're getting a 90-day supply, you would not see much pharmacy interaction from those patients from that week 13 through week 21, which is where we see another peak kind of occur in that May to July timeframe. Prescriptions for fewer than 28 days actually decreased at week 12, again, in comparison to baseline at the negative 5.8%. Because there was a decrease in provider visits and physicians really interacting with patients at this time due to stay-at-home orders, we do see that impact in the shortened pharmacy claims that were submitted. Next slide, please. And so as we discussed with chronic medications and that increased rate overall for having extended day supplies, we saw them more directly here with actually seeing them in the classes. So for oral diabetics, we saw a 25.9% increase in 90-day supplies being submitted, a 26.1% increase for our renin-angiotensin system antagonists, and those are going to be your ACEs and ARBs, and then a 23.9% increase for your statin medications or those to treat cholesterol. And so in connection with PQS and our pharmacy partners, we can clearly see that what the pharmacies were experiencing was actually being shown directly in the data. And so we have a quote here from one of our pharmacy partners over at Fort Rayleigh's, Mr. Quan Tran, where he directly gives insight into how the changes occurred during the pandemic. So when the stay-at-home orders were put into effect, again, patients wanted less in-person contact. And we see that with the actual pharmacy claim information that we've reviewed. And so prescribers are now sending in extended day supplies for patients. Again, insurance is allowing for extended day supplies to go through where they may have not had it before. And so now that we can clearly see that these chronic medication classes had an extensive increase in their rates for dispense, we now see here in 2022, really the fruits of the labor that occurred in 2020. Next slide, please. So as we previously discussed, we talked about how there was a quality measure impact to that extended day supply, the increase in utilization across chronic medications. And so what you see on your screen is actually our CMS Star Ratings, the thresholds that were set here for the 1 to 5 star ranges. And so for CMS, they actually update these across the quality measures every 2 years based on 2 years data in the rear. And so here we are in 2022, and we're discussing data from 2020. But as you can clearly see, having that increase in utilization has really increased the expectation for the 3, 4, and 5 star rating marks across the thresholds. And so you see for 5 star ratings, we are now either in the 90% expectations or very close to it across all of the measures. And so we wanted to just take a pause here and show this to really give visibility into the fact that what occurred with our patients in 2020 and seeing them take more of really initiative in making sure they had their medications and increasing that overall utilization in the pharmacy have now yielded to higher expectations when we're looking at performance and star ratings overall. Next slide, please. And so with the specialty medications, there was also a change here in their pharmacy utilization. So where we saw for chronic medications, there's a very high peak at week 12, and we continue to see that peak and valley throughout the year for them. Chronic specialty medications actually peaked here at week 15. And so on the left side of your screen, you will see a graph representing day supply dispenses for multiple sclerosis. And on the right side of your screen, you'll see a dispense for rheumatoid arthritis. And so for our multiple sclerosis dispenses at a 40.8% increase from baseline. And again, that's from week 3 of 2020. And again, for the right side at rheumatoid arthritis, they had an 83.8% increase again at week 15. And so we clearly see that not just for chronic medications that you would typically see in the pharmacy, but also those patients with more specialty disease states, they were also taking a really high charge in making sure that they were also taken care of. I would imagine that there were loved ones and just themselves that wanted to say, hey, we want to make sure we're all taken care of and we're okay. And so they were heading to the pharmacies. I would imagine a lot of these specialty pharmacies were also very eager to make sure they got their prescriptions out to those patients. And so we clearly see those results here on the specialty side as well. Next slide, please. And so on the changes in pharmacy utilization, the place of service also made a very dramatic change in 2020 when we're looking at the impact here. And so at week 12, like in our other graphs, we see that very large increase of rate. And that's actually at the mail order pharmacy. So the mail order pharmacy is there in purple versus in the gray. We're actually looking at community versus community and retail pharmacy utilization. And so we see that 30.8% increase there at week 12 in the mail order pharmacies. And a lot of that, we know what it is. Patients don't want to be seen, go to the pharmacy. They want to limit interactions. This was a very much so a time of uncertainty. And so we clearly see that as performance has changed with wanting more mail order pharmacy prescriptions versus what we saw at the community and retail settings. And that transition for the pharmacy, even on community and retail side, definitely made an impact of having a 10.5% increase from baseline of week 3, with the understanding that most community or independent pharmacies, they may, staffing, I'm sure, was probably an issue at this point as well. So I say all that to say that I'm sure that pharmacies were also seeing the vast increase in prescriptions coming in, and very much so boots to the ground, very hard at work in making sure that all their patients were being taken care of. And with health plans kind of relaxing the pharmacy limitations throughout the pandemic and really carried on throughout the entire year, we continue to see that mail order pharmacy continue to have kind of a higher rate over community and retail pharmacy settings. And so that wraps up chapter 1. I will pause here for any questions that you may have before handing it over to Andy for chapter 2.
All right, thank you, Brittany, for that introduction and overview of chapter 1. I want to remind the audience to please submit questions throughout the presentation today. We do have one for chapter 1 that we'll go over, and then we will hand it over to Andy for chapter 2. So Brittany, this question is related to 90-day fills, and this likely would apply to the setting of pharmacy care as well, mail order versus a community pharmacy. So we saw those really large increases in 90-day supplies and mail order at the beginning of the pandemic, that desire for less in-person contact. Do you see that continuing now? What do you think is going to happen as we transition to a new normal? Are we going to see these trends stick around?
That's a great question, Amanda. And I do believe that the pandemic has had a positive impact on consumers to really take more of a charge in their own health. And so I believe that since we saw throughout 2020 that increase in 90-day utilization carry on throughout the year, there may be for some patients that see it's actually more of a convenience for me to be able to have my medications on hand. It may even be easier to connect with their providers in certain scenarios to be able to have that extended day supply. We do recognize that for different patients and different disease states they may be going through, it may vary, but I would imagine that that trend would continue to carry on. I would not be surprised if We saw more pharmacies encouraging even those extended day supplies to make it easier on their staff and their side of the fence, while also encouraging the patient to really have that medication on hand as they need it.
All right, very good, Brittany. Please keep the questions coming. We will have time for more questions later in the session. But for now, I will hand it over to Andy to take a look at chapter 2.
All right, thank you very much, Amanda. For chapters 2 and 3, we'll be moving more into examining the effects of the pandemic on specific medications rather than its effects on setting and operations. Specifically for chapter 2, we'll look at the direct effects of COVID, and for chapter 3, discuss secondary effects of COVID-19 on utilization of specific medications. Here for chapter 2 with hypothesized COVID treatments. As Brittany established, the pandemic changed the way which providers and patients were, and in a lot of ways still are, interacting with our pharmacies. But it also affected the way in which pharmacies experienced the other side of things, their supply chain, as related to medication availability and medication usage. We won't dive deep into discussing some of that side of supply chain and shortages, but do keep these things in mind as we discuss utilization changes in this chapter. Here, we've got a quote from Dr. Christina Bookwalter, who in a publication on this topic commented that as soon as evidence surfaces for support of a potential treatment, pharmacies begin procuring the drug and global demand starts to increase, somewhat driving that shortages that we may have seen. The next quote here on this slide is from our trend report, emphasizing that everything we'll discuss is multifactorial. I want to emphasize that none of our analyses determine causation of the changes that we've seen. All of it was influenced by a storm of shortages, changing demand, changes in regulations, some of which Brittany mentioned, regarding prescribing practices, and even employment changes that may have caused some patients to lose their employer-sponsored health insurance. Next slide. For this chapter, we've focused on hypothesized treatments for COVID-19, some of which have good evidence and others that don't. These 4 medication or medication combinations are among those that were hypothesized as treatments for COVID-19. They show significant changes in utilization over the course of the year of 2020 and into the pandemic. Of course, this won't be, like I said, the only factor that affected their utilization, but certainly it's played a large role. Next slide. First up, we'll discuss albuterol, which is most commonly used as rescue medication for asthmatic patients experiencing an asthma attack. Albuterol saw an early change in utilization, spiking roughly at the same time as the declaration of the public health emergency. Usage through the rest of the year is somewhat depressed, as you can see here in the graph, but it isn't dramatically different than the prior year, at least through the summer months. Notably, usage was lower in the fall, possibly affected by ongoing shortages, but could also have been decreased in need due to more of the asthmatic population being cautious about their exposure to COVID. That's a trend that we're going to come back to and discuss again later that may be a part of this. Some caution about COVID exposure may have decreased these patients' exposure to things that could trigger their asthma and require the need or use of albuterol inhalers. The early spike in utilization of albuterol could have been driven in part by a recognition that difficulty breathing and a resultant lowered oxygen saturation were symptoms of COVID and the biggest symptoms that drove people to hospitalization. It was hypothesized that albuterol may alleviate these symptoms, and new prescriptions may have been written for non-asthmatic patients during this time. Alternatively, though, the spike could have just been caused by factors that Brittany already brought up, that some patients already on albuterol were concerned that they might not be able to get back to the pharmacy, they might not be able to get their fill for the next time. There was, even in the media at this time, some discussion of shortages of medications, and that may have driven patient behavior during this time. Next slide. Next med we'll look at is hydroxychloroquine. Hydroxychloroquine will likely be familiar, and you may not be surprised that we are discussing it here in the trend report and looking at its changes in utilization through 2020. It was hypothesized as a treatment in early 2020, in the early pandemic, and got a lot of news coverage. It was also fairly controversial, as the hypothesis of its efficacy was not based on empirical evidence, but the hypothesis that its mechanism of action could be beneficial to COVID patients. Despite that lack of empirical evidence, FDA did approve hydroxychloroquine for the treatment of COVID-19 through an emergency use authorization in week 13 of 2020. But as time went on and evidence turned out to not really support the use of hydroxychloroquine in this setting, the emergency use authorization was retracted by FDA. But elevated use does continue well after the emergency use authorization was retracted. Without really wanting to discuss the politics of this, there does seem to be evidence of continued elevation in usage, as you can see here in the graph, due to persistent belief in its efficacy and continued discussion of hypothesized efficacy in the media, which would have been in front of a lot of people. Because this is a medication used in relatively low incidence disease states as a chronic management medication, many were concerned about the supply for patients already taking hydroxychloroquine chronically. And there actually is evidence that we found for the trend in our trend report analyses that a large proportion of those receiving prescriptions for hydroxychloroquine early in the pandemic, particularly this spike that we saw in March, had no history of prior hydroxychloroquine use, which we'll see in the next slide. Next slide, please. The analysis here is around hydroxychloroquine for claims with less than 14 days supply, less than or equal to 14 days supply. And this focuses in on usage changes that were short, thus making them the likeliest claims that represent hydroxychloroquine being utilized for treatment of COVID-19, roughly a 2-week course of the disease, roughly a 2-week course of a medication hypothesized to treat it. The percent change in utilization for prescriptions meeting these criteria is huge, over 15,000% increase. Now, again, to reorient here, these percent increases are compared to the week 3 baseline of that year. So the 2020 line is compared to the week 3 baseline of 2020, and the 2019 line is compared to the week 3 baseline of 2019. In this setting, prior use in the analysis was defined as at least one prior claim for hydroxychloroquine from January 2019 through January of 2020. Essentially, had you had a claim for hydroxychloroquine in the prior year before this analysis. As a reminder, the emergency use authorization was issued at week 13, which is just after that first peak, and it was retracted at week 25, which is the lowest point of utilization throughout the rest of 2020. It is interesting that there's increased usage of hydroxychloroquine with short days supply throughout the rest of 2020 compared to week 25, where the EUA was retracted. We did analyze other days supply cutoffs, and I've not included the graphs here, but you'll find them in the full trend report. Consistently across those different days supply, we looked at here less than or equal to 14, and then other analyses up to 90 plus days. For context, the percent increase in 90 plus days supply was roughly 100% for patients with no prior use. So as the days supply gets longer and longer for these analyses, the percent increase upfront in March of 2020 does get less, but we did see even for the 90 plus days supply, there was roughly 100% change compared to baseline. Next slide. Additionally, with hydroxychloroquine, we'll here examine the combination of hydroxychloroquine and azithromycin. There was some speculation that the combination of azithromycin with hydroxychloroquine may have had anti-inflammatory properties. And as a reminder, this would have been desirable given that a good deal of the serious symptoms and risk of death from severe COVID is related to the elevated immune response of the patient. In evaluating the combination of these medications, our methodology is important to understand who was included and what we may have missed because of the way the data was structured. Because the data was organized and compared week by week throughout the year, we assessed overlap of claims for hydroxychloroquine and azithromycin in the same week. This means we did not use a rolling 7-day period, and we may have missed some patients with combination who could have received one medication on a Saturday and the other medication early into the next week, say on a Monday. But that said, the vast majority of patients with this combination did fill them both on the same date of service. Of note, you'll notice that this graph takes roughly the same shape as the graph we discussed on the last slide of 14 or fewer days supply of hydroxychloroquine. This is not very surprising, given that the short-term prescriptions for hydroxychloroquine are those that were most likely to have been prescribed to treat COVID-19, So it is no surprise that we see roughly the same trend with the combination of hydroxychloroquine and azithromycin. Next slide. Last for this chapter, we'll look at dexamethasone usage in 2020. Dexamethasone is a commonly used steroid for multiple settings where steroids are useful. Initially in 2020, dexamethasone saw a slight decrease, in usage, followed by increased utilization after the findings of the recovery trial were released in week 26, or the initial report anyway. The recovery trial, for context, was a study of roughly 6,000 patients who were hospitalized with COVID-19. These are hospitalized patients with a relatively severe COVID-19. 1/3 of the patients received dexamethasone and 2/3 received usual care. The primary outcome for the study was 28-day mortality. Overall, roughly 23% of patients died in the dexamethasone group, and roughly 26% of patients died in the usual care group. And that difference of roughly 3% mortality was found to be statistically significant with decreased mortality in the dexamethasone group. So this study, combined with other evidence, anecdotal evidence as well, began to support the use of dexamethasone to reduce mortality in COVID-19 patients receiving respiratory support, especially at either oxygen or ventilation. And this was followed up by issuance of guidance from the World Health Organization to include corticosteroids for patients with severe and critical COVID-19, presumably those patients that are hospitalized. So with that in mind, keep in mind as well that this graph is showing claims for medications, and it will not reflect the utilization of steroids in a hospital setting where we would expect to find the most patients with severe COVID-19. So these increases may have been driven by those that had non-severe COVID-19, or possibly those who were hospitalized with severe COVID-19 and then received dexamethasone at discharge, though that would conflict with the World Health Organization treatment guidance against the use of corticosteroids in patients with non-severe COVID-19. So again, here, some of this may have been driven, like the utilization of hydroxychloroquine, by hypothesized efficacy and coverage in the media. Next slide, please. So there we'll again take another brief pause. Amanda, I'll pass it off to you for any questions.
Thanks, Andy, and thanks for that overview of Chapter 2. We do have one question related to the content you just delivered, and that's about ivermectin. So you've talked a lot about different hypothesized treatments for COVID-19, and this one, I suppose, is a little bit newer on the scene than some of the ones you've already described. So did you look at ivermectin at all, and if so, what did the data show you on that?
That's a really great question. We did not, for this trend report, examine ivermectin because, as you mentioned, it was a little more recent. So looking at the 2020 data, which the trend report did focus on, the change or the discussion of ivermectin was not as prevalent in 2020. So I would guess, my best guess would be that if we looked at it, we'd see some pretty wonky things about its utilization, but that was not a part of this analysis.
All right, thank you, Andy. Yeah, I agree. We'll probably see something pretty wonky there as well. Just one last reminder to the audience, please keep questions coming. We will have a time for more questions and answers here in just a few minutes, but Andy, I will hand the floor back to you for Chapter 3.
Excellent, thank you, Amanda. For Chapter 3, we'll move, like I said, from direct effects on usage from COVID-19 to those that were more secondarily affected by the changes in the way we lived. So as we wrote in the trend report, the trend report broadly evaluates utilization patterns of medication classes likely indirectly impacted by the COVID-19 pandemic. Before this section, we'll examine specifically these 3 classes of medications and discuss what factors may have affected their utilization changes during 2020. Next slide, please. First, we'll look at antidepressants. Much in line with the general trend along medications or across all medications that Brittany discussed in Chapter 1, there was an early increase in March 2020 in utilization. You'll see there in that purple line. Throughout the rest of 2020, there was relatively less seasonality in usage than there was in 2019. The line is actually remarkably flat through the rest of 2020. As a reminder on these graphs, again, keep in mind that analysis compares to a baseline in the same year and only shows change compared to that baseline. So the 2019 line is compared to the 2019 baseline and so forth. You'd be forgiven looking at this graph concluding that overall usage was lower in 2020 because the line is relatively lower in 2020 than 2019. But it was really the opposite, given that the baseline comparator for week 3 in 2020 was at a higher absolute value than it was in 2019. The fact that more antidepressants were utilized in 2020 compared to 2019 may not be surprising, given the stress we know that many were experiencing throughout the year and then seeking therapy and treatment. The lack of seasonality in the fall in 2020, I think, is interesting and may have been driven by difficulty to find appointments with mental health providers or some of the other reasons that we've described and discussed previously, considering insurance changes or potentially other changes in prescribing. Next slide, please. Next, we'll look at anticoagulants, and specifically direct oral anticoagulants and warfarin. Now, this graph is a little different than many of the others that we've looked at, as this only shows 2020 data, and we've split out warfarin and direct oral anticoagulants into the two different lines. And I'm not showing it here, but I think it's useful to establish and set the stage that in 2019, DOAC use was already on the rise and warfarin use was declining. This is likely due to the release of new clinical guidelines for management of anticoagulation that favored the use of DOACs over warfarin more so than in previously released guidelines. Initially, for this analysis, when we were hypothesizing what to analyze, we thought that the data in 2020 would show a trend towards switching from warfarin to DOACs due to cautiousness about COVID exposure leading to less desire for patients to be in clinic for INR monitoring, similar to how Brittany was describing patients did more curbside pickup and more 90-day fills for some cautiousness about not wanting to be in pharmacy spaces. However, we don't really see this happening in the claims data in 2020. This could have been for several reasons. Not every patient is a good candidate to be successfully managed on DOACs clinically. And also, when you consider a patient who's rock solid on warfarin and has been for years, there may be more risk in switching to a DOAC than in any possible COVID exposure for coming to clinic for INR measurement. Ultimately, the data for 2020 do show a roughly similar decrease in warfarin usage and increased usage in DOAC as we saw in 2019. So the trends, interestingly, in 2020 were not terribly different than what we saw compared to each other between DOACs and warfarin in 2019. Next slide. The final class we'll discuss is antibiotics. And I have to say, personally, I find this graph to be one of the most interesting, this analysis to be one of the most interesting in the whole trend report, as this is really evidence indicating that we lived different lives in 2020 than in previous years. Unlike many of the other med classes, antibiotics did not see a spike in usage in March of 2020, and rather they actually saw a pretty precipitous drop in utilization, nearing roughly 40%. And decreased utilization throughout the entirety of 2020. We also didn't see the typical increased usage of antibiotics into the fall, as you could see here happened in 2019. When thinking through what this means and what this graph shows, we feel that this shows the population was less exposed to infectious agents than in the previous years due to decreased social activity, decreased travel, simply decreased exposure to the world outside of our houses. That lowered exposure to the world led to lower infectious rates, we think, and lowered the need for antibiotics. Wrapped up in this, of course, could be other factors, like a decreased ability to get a doctor visit in short notice, or with more people, so potentially more people with mild infections or non-specific symptoms who would otherwise have gone to see a doctor and gotten a course of antibiotics for what they had, may have not done so, toughed it out and got better. Or many multiple factors, but really we see a dramatic decrease in utilization through 2020. And I think this is well demonstrated by the case numbers for the flu in the 2020-2021 flu season, which we would have seen in the fall of this data. The flu season of 2020 to 2021, only saw 1,316 documented cases of the flu, whereas the previous season, a year prior, had seen over 130,000 cases, a change of roughly 100 times fewer cases of the flu in this flu season that we see here. Certainly, we could argue that flu was underdetected in 2020 to 2021 because more tests were happening for COVID and more people were concerned about COVID. But it's hard to believe that it was as prevalent as the prior year, just given the fact that the confirmed cases was 100 times lower. We simply led different lives in 2020. And I feel that this graph bears that out and tells the story in the way that we saw claims for antibiotics change over the course of 2020. Next slide. So in summary, to wrap us up, the trend report, we endeavored to examine what was happening in pharmacy spaces, what was happening with utilization of medications across 2020, and how the things that we were doing and the external effects on the market were changing what happened in pharmacies and with medications. We saw a spike in claims in March of 2020 for most medication types and for most pharmacy settings. Particularly, we saw a shift towards 90-day supply that was sustained through 2020. And as Brittany was talking about, we anticipate that change will be seen ongoing. For Chapter 2, we looked at utilization changes by discussion of hypothesized COVID-19 treatments in the media or otherwise, and saw that we had some pretty dramatic changes to the medications that were hypothesized to be used to treat COVID-19. In Chapter 3, we looked specifically at secondary effects of medications not to treat COVID-19, but whose utilization were affected by the fact of COVID-19 in antidepressants, anticoagulants, and antibiotics. We've been able to discuss some of the highlights of the trend report. The full trend report is available for you at pharmacyquality.com. If you're interested in learning more about these topics or diving into more graphs, more data that we have there in that trend report, I invite you to go and seek out the full trend report on our website. But thank you very much, PQA, for hosting us and having us here to discuss some of the interesting things that we saw in looking at medication utilization through 2020. Amanda, with that, I'll pass it back to you.
All right, fantastic. Thank you, Andy. Thank you, Brittany, for sharing the report with me and with our audience today. Please do keep the questions coming in. We've got a little bit of time here for some additional Q&A. One I would just like to start with, first of all, Andy, you mentioned the antibiotic graph and how interesting the trends, the really dramatic downward trends there were in antibiotic utilization throughout, especially the beginning of the pandemic. One thing that just popped in my head when I looked at that, and this is probably outside of the scope of the report, but I wonder what the downstream effects of that would be. But are we going to see a lot fewer C. diff infections as an example, as consequence of less antibiotic usage, just antibiotic resistant infections in general? And maybe what is it we can learn about antibiotic utilization and the consequences from this really dramatic change? It'd be interesting maybe to see some retrospective data come out about that. I'm interested in your thoughts.
I would hypothesize the same things as you, that we might see less resistance coming out because of the decreased, or we might say not only decreased utilization, but perhaps more targeted utilization. The people who sought out antibiotics through this time may have been more appropriately treated with antibiotics. Like I said, some of those people with non-specific symptoms or very mild infections who may not have sought out treatment during that time. You could say that some of those increase the utilization of antibiotics and may lead to resistance development. I'm going to be taking some notes. I think you've given me some good ideas. We are going to continue to do trend reports year after year. We're working currently on the 2022 trend report, but are thinking through some ideas of things we might want to examine for the 2023 trend report. So thank you for giving me a good idea.
Absolutely. So this is a question dovetailing on that thought, Andy, for both of you. Brittany, at the beginning, you mentioned that this 2021 trend report was different than ones PQS has produced in the past. Do you expect to stay with this sort of theme, or are you going to kind of switch back to what the trend report has been historically? And what can we look forward to this year?
That's a great question, Amanda. So we are going back to our roots for our report for this year. We are outreaching to our payer and pharmacy partners to give us kind of their feedback on how they are taking care of either their members or their patients in the pharmacy. So a lot of the data that will surround that will really be directed to, for the payer side, is understanding the types of value-based programs they will have, and just ensuring that they are inclusive to pharmacies and really expanding that capability. And then pharmacies actually being able to participate in those programs and understanding their patient population and what their needs are. And then on the consumer side of that, of just really patient comfortability in the pharmacy. Now that COVID-19 has been upon us, we do have kind of that added commentary in there as well, as far as how pharmacies may or may not have been impacted with COVID-19. Do you plan on doing vaccinations or not? And so we will incorporate some features of the COVID-19 pandemic into this report that we are currently formulating for this year, but kind of going back to the original demographic of how it was originally created. That does not mean we can't ever create specialty reports, Amanda. As we did in 2020 when the pandemic was first among us, we did kind of like a very brief output and related to the pandemic when it occurred. So like Andrew said, you've given us some things to think about as far as other kind of smaller, short-term reports that we could put out for everybody.
Let's hope not another pandemic to cause a special report. All right, Brittany, this question's for you too, related to some of your chapter 1 content. It's about stockpiling. So have you seen any bleed over effect at all from prescription stockpiling? So, the huge spike in fills in the first part of 2020, the question asker says that they saw in the first quarter of 2021 a different refill pattern. So there were longer gaps between refills in 2021. Have you seen any of that in the data kind of as a holdover effect of what happened in 2020?
Yeah, so there's variations to that, Amanda, and thank you for that question in the audience there. What we are currently seeing and we've heard from pharmacies, again, like we had spoke to before, is that patients are just being a little bit more aware of what they either have or what they need. And so we've talked to pharmacies before that most patients either getting a brand new health plan. And so they're really excited, right, to get to the pharmacy and get their fills. Usually every year, it's January 1st. Pharmacies are really busy because they're trying to get fills. And so I wouldn't necessarily call it stockpiling, but more so that I guess elongated time frame for first fill has been extended a bit. A lot of that could be due to those 90-day supplies that would have continued to be refilled throughout 2020, then pass over into early 2021, where they're like, hey, I actually still have medication on hand. So I don't really need to rush to the doctor. I don't really need to go into the pharmacy just yet. We have also seen where some patients are being a little bit more, cognizant about how they're engaging with their providers as well. And so for some patients, they're like, if you're on an oral diabetic and maybe you've actually achieved not having to take that daily anymore. And so now I don't have to go in the pharmacy and get this filled if I've already achieved kind of my health outcome that I need to have done. And so with patients just being a little bit more just cognizant and aware of where they are, not so much stockpiling, but just understanding where it makes more sense to go to the pharmacy versus seeing a provider and doing other kind of things to help with an overall healthier lifestyle.
Okay, very good. Thank you, Brittany. Andy, question for you back on these, I guess what we're terming hypothesized treatments for COVID-19. Do you have reason to believe that you're going to continue seeing influence either on the popular media, social media, that's going to influence medication utilization? Is this going to be a holdover effect this year as well?
I think that it probably will. We don't know. I won't claim to know what effects it will have and which medications specifically it might affect. But if the average consumer, if you had asked them 3 or 4 years ago to name a pharmaceutical company, then you probably would have gotten far fewer people who knew the name of a pharmaceutical company than know the name of pharmaceutical companies, particularly those now that have been producing COVID-19 vaccines. There's a lot more awareness in the general population about healthcare delivery, what kind of settings are available and what kind of settings are possible. So I would be surprised, having now demonstrated the power of media and the power of discussing specific medication therapies that can have on the utilization of medications. I can't imagine that we won't see it again. What form it may take is anybody's guess, but we really did see a lot of power in the the medication usage and discussion between providers and patients and what was prescribed based on discussions in the media of medications.
Mm-hmm. Absolutely. Okay, thank you. And we've had another question come in looking at star ratings. And so I'll throw this question out to either one of you. So looking at star ratings for 2021 compared to 2020, do we have any sense for how those are going to compare to each other? Did the 2020 rates that were higher, are we going to see those achieved again with 2021 data, or what is that looking like? What's the early sense there?
I can take that, Andrew. So we see a bit of a rollover effect as far as achieving kind of that increased rate in the pharmacy. But again, a lot of it is just really awareness, right? So the pharmacies are more aware now of what their patients really need, how they can take care of them, whether that's through automatic refills or through like compliance packaging. Maybe that makes it easier for them. 2020 taught us all a lot of different things. And so I think because of that, 2021 is really a positive reciprocal to it. We have actually just finalized 2021 year-end data in Equip. And so pharmacies are now able to see how they did throughout the year. And then we'll be actually working directly with our pharmacy partners to review where that data was in comparison to 2020. And so I cannot exactly say that everything is exactly as it was in 2020, since that was more of an anomaly year. But I would imagine that, as with everything, there is some improvement and there is some performance increase that will occur year over year. In relation to the star ratings, what we would see again for 2021 performance will impact those star rating thresholds that we see from CMS for 2023. And so when those star rating thresholds actually come out later here in the year, it's usually about September, October is when we'll see that. We'll either see those rates still at least remain the same for how the expectations are set for 2022 ratings, or we will see them alter a bit based on 2021 performance. But I think if anything, it was definitely a learning experience for everyone. And we've had some positive influence to what those performance scores are, and just allowing for some more optimal kind of understanding of how to take care of the patients in the pharmacy.
All right, very good. Andy, do you have anything you wanted to add there?
No, thanks.
Okay, perfect. So question just about overall utilization of pharmacy services in 2020. I mean, you showed us a lot of different graphs breaking things down in a lot of different ways. So if we just kind of maybe take a step back and talk about overall pharmacy utilization in 2020, by dispensing and services, how did that compare to previous years and what sort of patterns did you see there?
Yeah, so pharmacy utilization overall, like we said, had a very vast increase. And so now not just from actual dispense rates, but we're also seeing an increase in immunizations actually being done, right? So now pharmacies have the opportunity to actually provide COVID vaccinations to their patient population. We also see influenza rates actually increase as well, where some people are coming in, they're like, hey, I got to get my COVID vaccine, I'm going to get my flu vaccine at the same time. And so we see where it's more of an understanding that pharmacy services are actually a little bit easier to access and a little bit more relatable for folks. And so where I know that there have been some kind of pharmacy staffing issues just across the board from other, staff members that may actually contract COVID-19 or, a demographic type issue that may actually occur. I think patients and just everyone in overall is able to actually understand there's a lot of things that you can do in the pharmacy to actually help you with your care. And so whereas at one point a pharmacy may not have actually offered maybe like home delivery, as we discussed, right? Now it's like, okay, we got a delivery driver. We actually got to get somebody out there to actually get them their medications. Maybe they didn't offer compliance packaging before. Well, now they do. And now they have more patients coming into them. And so from an overall perspective, we do see pharmacy utilization vastly increase. We see the number of services that are offered vastly increase. And hopefully here with this year's trend report, we'll be able to also report on overall patient comfortability and ultimately the reliability of the pharmacy and how those services are applied. So very happy to see that pharmacies are coming into the fold as obviously a very valued sector in the healthcare environment for consumers.
Absolutely. All right, we have about a minute left or so here for our Q&A. So just wanted to give each of you a chance to leave our audience with some final thoughts. So Andy, do you want to go first on that one?
Sure. First off, just thanks for the opportunity to talk through all of these things. We see a lot of interesting trends and happy to discuss these things. A lot of work went into these trend reports. We will continue, as Brittany mentioned, to produce more trend reports and are working right now on the 2022 trend report, for which we're going to be doing some surveys. So I imagine many people that are a part of this may be hearing from us. So we would encourage you to please respond to those surveys as they come out so that we can have good, robust data for that 2023 trend report. We'll be looking at some of the things that we've already touched on, of changes of utilization and changes in perceptions around pharmacy services. But overall, we saw very interesting things in 2020. It was surprising some of what we found and surprising some of what we didn't find. But if you have more questions, you can, again, find the full trend report at our website, pharmacyquality.com.
All right, thank you, Andy. Brittany?
I found the unmute button, sorry, Amanda. I just want to thank everybody for coming on today. And one of the key reminders, like Andrew said, just about the trend report overall, is that there's just a lot of interesting pharmacy data out there. And so we're happy that we can bring that to you all. As Andrew said, we'll be incorporating with some of our pharmacy and payer partners throughout this first quarter of the year to get more engaged, to give you guys more pharmacy trends and information. And so looking forward to continue to connect with PQA to be able to provide that outwardly. So thank you all.
All right. Thank you, Brittany. Thank you, Andy, for joining us today. I really appreciate you sharing with all of us.